I got a couple things, man. Have you seen? Gosh, I don't want to be morbid, but are people losing their
Mm.
lives, generally speaking, due to this healthcare crisis that we have in America? Are people dying? What's going on from your vantage point?
I would say, from my vantage point, just based off of, I wouldn't even say my own practice, but just kind of what you see in the community, what you know, talking to people on social media, I would say absolutely. I mean, somebody messaged me, somebody found out I was going to be on your show tonight talking about healthcare. And I got a message from a woman who told me that she knows someone who is homeless, who has no health insurance, who has cancer and is getting no treatment. So, I mean, yeah, I mean, now that person does have the option to go to the emergency room like everybody else does, but the emergency room is not where you should be going to be getting care. You should be going to the doctor. But again, I work for a large hospital and we used to have amazing insurance where I had like $5 copays. I didn't have to pay anything to see my doctor. I just had the flu. I was sick for like 3 weeks. I had to pay $50 to get Tamiflu, which the most I ever paid for medication was probably $10. I got to pay $20 to see my doctor. You know, if I go to a medical aid unit, I think it's $50. All of these things used to be free, but I'm paying more for my insurance and I'm getting a lot less in return. So
Uh,
you can't even afford. Everybody has insurance. It just doesn't. You can't afford to use it.
right, right. There you go. There you go.
Yeah, and that's the
If
saddest
you're
part about
poor, yeah,
Obamacare.
that's if you're poor. If you don't have the money, then you don't have. Then how can you get the appointment? You
Right.
know, like
But I mean, look
I
at that.
don't.
So
Yeah.
I went to the doctor. It's $20. I get the Tamiflu. That's $50. You know, money for driving. I had to get an inhaler. I mean, it's $100 to see the doctor and get two medications. That's crazy. Like
Yeah.
I'm a nurse. My fiance is a teacher. We make good money. I don't have $100. You know, I got 3 kids. I don't have $100 to be thrown at every time I get sick. I'm just gonna sit in my basement and drink water next time. I mean, like, what are you gonna do?
Right, right. That's what most people
You know
do.
what I mean?
Then unfortunately sometimes it's serious. And then those
Exactly.
people
They end up going into the ER much later than they should have because of the financial fear, and they're really sick, and sometimes they die, and family members are losing loved ones because they don't have the money to pay for routine health care. And that's an extremely sad thing in America.